Hey, hi everybody. Welcome to our Educating Empowering You program. We're obviously here still on WebEx World and just grateful that we have the opportunity to provide this program out to the community. This is being recorded and will be later provided out via multiple platforms for people to listen in at a time that maybe might work better for them. So I am Sarah Clute-Bain. I'm the Boone County Hospital Foundation Director. And I'm really pleased today to welcome Will Evans, who is with Restorix and works primarily with our wound clinic here at Boone County Hospital. He is an RN and the regional director for Restorix. So I'm going to let him have the opportunity to share more about himself, and maybe just as we get kicked off here, if you don't mind telling us also a little bit more just in general about the wound clinic itself. I know today our topic is about nutrition and wound healing and all that very specific information, which is great information for everyone, not just people, of course, healing wounds, but because of it being that specific or that specialty this month, just taking a closer look at that. But we'd love to hear from you, Will, more about yourself and about the wound clinic.
Great. Thank you so much, Sarah. And like Sarah said, my name is Will Evans. I am a nurse and my position is the Regional Director of Operations for RestorixHealth. And RestorixHealth is a wound care management company that operates throughout the country. We have approximately 250 different clinics that we partner with, such as Boone County Hospital and Mary Greeley Hospital as well, are a couple of our local ones. So I travel around a little bit between Iowa, Northern Illinois is mostly where my territory is. Go to about 13 different hospitals that we partner with in my area. And some of those I will do educational events like this. I'll also work with the staff and the directors at each of the hospitals. Been with the company for a few years now. It's been a great journey to be with. Learned a lot about the wound care industry and really what causes wounds, how to heal the wounds, and a little bit about each of the processes. As Sarah said, I'm here to talk about nutrition today and how nutrition plays a role in wound healing. The wound clinic at Boone County Hospital is a very unique clinic. It's an advanced clinic that helps with persons with chronic wounds. And I'll talk a little bit more about that, Sarah, here in just a little while. First, I think I wanted to kick off with nutrition, and then we'll go into how that really plays into and rolls into the wound portion here. So I know that you have all been here nutrition. You've had the different types of pyramids over the years, the different food groups that you talk about. When it comes to wound healing, nutrition is even more important. So it's often overlooked, and good nutrition is extremely important part of the healing process. Wounds must be well fed to heal, requiring increased amounts of calories, protein, water, and specific vitamins and minerals. Let's see if there we go. Get to the next slide there. So during the healing process, the body requires an increased need for both energy and protein to heal wounds. Poor nutrition before and or during the healing may slow the delay the rate of wound healing. There's been a clear correlation between nutritional status and healing. Therefore, a balanced diet with adequate fluids for hydration, calories, proteins, and nutrients is fundamental to the healing process. When poor nutrition is present, wound healing can be delayed or worsen, it could even stall. So you may be at risk for nutrition-related problems if you're a person with diabetes, or you just have poorly controlled blood sugar. Maybe you're suffering from depression. You may have unintentionally gained or lost 5% or more of your body weight in the last month, or even 10% in the last 6 months. You may have a chronic condition such as heart or kidney disease, stomach or intestinal tract disorders that interferes with absorption of nutrients. And sometimes what we'll see that in is persons that may have undergone a colon surgery or removed part of their colon. Maybe you have tooth or mouth disorders, which makes it difficult to chew your food. You may live alone, have trouble getting out of the house and getting groceries, which the nice thing about nowadays is a lot of grocery stores will deliver. And you may take more than 3 medications, including over-the-counter drugs. So there are several different nutrients that we look at when we're looking at enhanced wound healing. One of them, of course, is just all food intake in general, which is going to be your total calories. You're going to need approximately 15 calories per pound of body weight each day. Hydration is obviously something that we'll also need to look at. And you'll need to eat complex carbohydrates to control your blood sugar, as well as whole grains and vegetables. Make sure that you're eating enough protein because it supports new cell and tissue growth needed for wound healing. We'll talk a little bit more about protein a little later here. Very important through all phases of healing is that protein. Which is required to promote new tissue growth. It's vital that you get adequate protein for wound healing to occur. The average person or the average male needs about 56 grams a day, whereas the average female requires about 46 grams. So just kind of a quick reference on that. If you look at a 3-ounce chicken breast, that contains about 21 grams of protein, and a one cup of dried beans contains about 16 grams. Check your labels, add up your protein, make sure that you're getting enough. Some other foods that are very high in protein are going to be chicken, fish, turkey, eggs, yogurt, peanut butter, cheese. Those are all good options. Trying to limit your fat intake can also help improve your immune system. As mentioned here a little while ago, fluids is an important part for the hydration portion. So you need to drink a lot of extra fluids in order for your kidneys to process the additional protein that you're going to be intaking. It's also to replace the fluids that is going to be lost through the wounds that you have. If you have heavily draining wounds, you'll need to drink even more. You need about ½ ounce of fluid per pound per day. Therefore, a 150-pound person would need about 75 ounces a day. Choose your fluids wisely to avoid sodas and sweetened drinks because sugar has been shown to decrease the activity of your infection-fighting cells, which will put you at higher risk for infection. And if you're looking for how do I determine what the ounces are, just think a soda bottle is about 20 ounces. So consult with your healthcare provider or your primary care provider for your optimal fluid intake if you have other underlying health diseases such as heart failure or decreased renal function, kidney disease. Vitamin C is very important also. It's known to be an essential vitamin in the role of tissue repair. Vitamin C aids in the tissue regeneration and collagen formation. So vitamin C is going to be heavy in citrus foods like oranges, lemons, limes, grapefruits. Kale is also a very good source of it. Be careful not to take too much vitamin C because it does store in the fat cells and high levels can become toxic over time. A few other nutrients that we're going to look at are vitamin A. Vitamin A is another it's a fat soluble vitamin that needs to be taken with caution. Foods that you're going to find that in are going to be things like liver, eggs, egg yolks, broccoli, peaches, carrots, greens, apricots, tomatoes, sweet potatoes, and milk. This one, make sure that you're consulting with your provider so you're not taking too much of this. Vitamin Bs or the B complex vitamins are also important to look at. We can get them in a variety of foods such as B6 may be high in content in different meats, poultry, fish, whole grain breads, and cereals. B12 is going to be in your meat, poultry, fish, eggs, and milk. Vitamin B is going to help aid in the prevention of anemia. And again, additional items that we're going to be looking at are going to be your trace minerals. So trace minerals are going to be like your zinc, iron, copper. Zinc is going to be high in baked potatoes, dried beans, peas, oatmeal, rice, shellfish, spinach. Iron, you're going to find in beef, pork, beans, peanuts, tuna, enriched breads and grains, eggs and spinach. And copper is going to be found in high concentrations in nuts, dried beans, dried fruit, whole grain cereals. Arginine is an amino acid, as is glutamine. So when I kind of talked about protein earlier, protein is very heavy in amino acids. So when we're looking at protein, protein is just basically a word that is going to mean it's a molecule built of multiple different amino acids. We have about 20 different amino acids that build up our proteins. So out of those 20, a little over half of them can be produced by our body. So our body can break down the other protein, the protein that we're intaking, and it can reconstruct it into about 11 of those amino acids. 9 of the amino acids that our body requires, though, have to come through our diet. When we're looking at wound healing, some of those amino acids are used in higher concentrations than they normally would be. So ensuring that you're getting adequate protein intake is going to be very, very important. Arginine, for example, helps to increase blood flow and oxygen to a wound, resulting in additional collagen formation. And it also helps to reduce our inflammation, where glutamine, the amino acid, helps to stimulate that collagen production also. So a couple suggestions that we have for getting the nutrients that you need would be to take a good quality multivitamin, which it contains at least the recommended daily allowance of zinc, iron, copper, and foods containing vitamin C, vitamin A, and trace minerals. If you're having difficulty getting the recommended daily amount, maybe you just can't eat that amount like we talked about earlier. If you have difficulty chewing, have a hard time with your appetite, you may want to supplement a little bit with products such as Juven, Boost, Ensure, or Carnation Instant Breakfast. You can always add a little bit of peanut butter or almond butter to help with enhance the flavor. And you can find recipes for protein, different types of protein shakes on the internet. If you don't feel you can eat 3 large meals a day, try doing smaller meals and maybe 5 or 6 of those a day. We talked a little bit about hydration earlier being important. One of the things on with wound healing is a lot of wounds are going to happen as we age, as those disease processes get a little bit worse. And as we age, we start to lose that sensation of thirst. So it is really important to realize that even though you may not have that sensation of thirst, you're still going to need that additional hydration. So how does a wound center play into this role of nutrition and for your wound healing, such as coming to Boone County Hospital? We have providers here with advanced training in wound care management. Our nursing staff is trained in the care of non-healing wounds, and we have experienced staff to help make sure you can get your appointments made. And the insurance is going to cover all of that as well. What can you expect when you get here? So we have a very systematic, comprehensive step-by-step approach to manage and treat your wounds. We actually have a 7-step process that we look at 7 specific things as you come into the clinic to ensure that you're healing adequately. Evaluation treatment by our team is going to include the assessment of your nutrition, your exercise, and your lifestyle choices. What we're going to encourage you to do is eat balanced meals that include the right amount from each of the food group. We'll talk about including plenty of fruits and vegetables in those meals, and how hydration and vitamins play in, and mineral absorption plays into your wound healing. So when you want to call us is when you notice that you have a wound that is very slow to heal, or it just has not, you've had it for a while and it's not healing at all. Maybe you're diabetic and you have a wound on your foot, or you have leg ulcers that are not healing. You have surgical wounds that are not progressing in the way that you and your surgeon have talked about for the healing portion. You have non-healing skin grafts or surgical flaps. You may have symptoms occurring around the point of radiation from previous radiation treatments. You may have a bone infection and you've been on antibiotics for a while that has not been healing, or maybe you have suffered a crush injury. The way we measure that is as a general rule, we kind of look at if that wound hasn't healed by 40%, or it's not about half the size that it was 4 weeks ago, we want to consider that a chronic wound, and you should be looking at a wound care center to help you with that healing. You don't need to wait the 4 weeks. If you have any suspicion that that wound is going to be difficult in healing, or even a history in that, make sure to call your wound center. A couple of the things that you're going to expect when you get here is, one, we're going to be setting up weekly appointments with you. So it's important for wound healing that we go follow that, like I said, that 7-step process. And one of those processes is going to include weekly visits where we're going to be doing a debridement of that wound. And what that simply means is we're going to kind of scrape off that what we call a slough on the top of that wound, and that will encourage the wound to heal a lot better. We'll also clean off the margins and make sure that you've got good, healthy tissue that will help close that wound in. And it's important that we do that on a weekly basis, and that you also attend those weekly visits. The next part is, since you're only here once a week, it's when you go home that you're following the provider's instructions. So nutrition is that key factor there, that when you get home that you're following their instructions and the expectations for that nutritional status, that you're also offloading those wounds. So you're not putting that continued pressure on that wound anymore. If they're ordering compression for that to help decrease that inflammation, the fluid around that wound, we're going to ask that you do that at home as well. That you're taking your medications as prescribed. You're monitoring your blood sugar, you're getting plenty of rest, and of course, coming back to nutrition, eating healthy. Compliance that you have with your plan of care is going to be the single most important factor in getting that wound healed. So if you need to make an appointment for this, you're going to wonder when am I going to be able to come in? We're not a clinic that's really open after hours or weekends, so we're going to be typically about an 8 to 5 Monday through Friday, which can be difficult for some persons that may work. However, call us. We will try to work with you and find a great way to get you in on a week-to-week basis. A referral is not required to come in, so we do take self-referrals. Feel free to just call in. The phone number for coming to the Boone County Hospital is going to be 515-433-8740. Again, that's going to be 515-433-8740. And the person that answers the phone is going to be able to help you set up an appointment. And do we have any questions?
I have a bunch of questions, if that's okay.
Sure.
I'll ask away, and then hopefully maybe I'll cover some of the questions that the folks out there have. And if I don't, then feel free to chime in on the chat as well. First of all, just to follow up right where you left off, can you talk a little bit more about, and maybe you mentioned this, I apologize, a provider referral and how that works?
Absolutely. So your provider can refer you to the wound care clinic by simply just calling the clinic. And we do have referral forms that we can give to your provider that they can fill out and fax over to the clinic as well. So if you don't have a referral from our provider, that's okay. You can call the clinic yourself or call the hospital and just ask to be sent to the wound care clinic, and they can still set up an appointment with you. Most insurances don't require a referral. However, if your insurance does require or a referral from your provider, once you get here, we can call your primary care provider on your behalf to get that referral.
Great, thank you for that. So a couple of questions in regards to your presentation on the specifics around vitamins and having certain types of foods that relate to each of those areas. I mean, I think most of us, like you mentioned in the very beginning, most of us have received some kind of nutritional information, but I think that was really helpful that you were listing foods that fell in each of those categories. And I didn't know, is there like a booklet that you hand out to patients with that information in it? Or is there some way, if, for example, somebody here listening today wanted to have those guidelines along with some suggestions that they might be able to receive that?
Absolutely, that's a great question. So there is an ample amount of information out there, and yes, when you're coming to the clinic, we'll definitely help advise you on what type of foods to eat. A good source too is, other than the internet, is also working directly with a dietitian. And in Boone, you're very fortunate to have such a great supply of dietitians. So of course, talk to your primary care provider, talk to your dietitians. You can find those. Boone County Hospital has dietitians. Fairway and Hy-Vee both have dietitians, and just simply talk to them there, and they can help consult you on what foods are going to be rich in the supplements that you need. And of course, most of the foods that you're buying is going to list out what they have and what the percentage of the RDA or the recommended daily allowance is on these foods.
Great. And we also have the diabetes educator here too, which I think is also important to mention because I'm guessing that you work with her quite a bit as well, with Kathy Moan.
Absolutely. So in wounds, a lot of diabetic management and diabetic education is required to ensure not just for that wound healing, but to help prevent this from happening in the future.
Great, great. So I have a very basic question that I'm hoping as an RN you can also help us.
Sure.
Explain to me what the difference is. How would I know the difference between a wound and just something that is not something to be as concerned about? Does that make sense? A sore versus a wound, like what are you looking for when somebody needs to come to the wound clinic?
Absolutely. No, that's a great question. And just as referred to a little bit more is if you're not noticing a change in size and mark a date down, you're kind of wondering what it's looking like, take a picture of it, take a measure it yourself, put maybe something clear over top of it and trace it, and come back to it a week later, come back to it 2 weeks later. If it's within 4 weeks, that one's not half the size of what it was, then that's what we're considering chronic. Now, you can extrapolate that because if it's only 2 weeks in, you should have noticed about a 20% reduction there. So it should be about a quarter of the size. And if it's not, definitely time to talk to your provider about that. But you're right. There's some ones that you and I cut ourselves. I mean, we're going to expect that it's going to take a couple weeks for it to heal. It should be going through that progression too. The other thing that we're looking for is things that just doesn't look right. Maybe you have got a drainage that is a color that is maybe it's a green color, a creamy color, brown color, and that drainage is persisting for more than a couple days. If you got excessive pain around the site, or you're noticing red streaks that are emanating from the center of that spike, that's an indication there may be an infection there. Maybe you have a foul smell or an odor that's coming from it. Definitely times to talk to your provider about that. It may not be a wound that requires advanced wound management, but it may still be an indication to talk to your provider. And then also, it's locating those wounds too. Sometimes we don't know that they're there. A lot of persons with diabetics have what we call neuropathy, which is basically a decreased sensation in our nerves. And the early signs of neuropathy usually come with a little additional pain, but later signs come with absolute lack of sensation at all. And so we don't know that we may not know that we have a wound. Maybe we can't see the bottom of our feet or see underneath our toes, which is where a lot of these wounds originate. So it should be probably a very good practice. Part of your normal weekly routine is to somehow look at the bottom of your feet, whether you have somebody doing that for you, or if you don't have somebody that can help, a mirror can be that. Laying a mirror on the floor and holding your foot above that mirror is a good way to see the bottom of your feet.
Great. So that leads me into kind of my next question too, is that typically I was thinking wounds are primarily going to be in the feet or like on the feet or in kind of areas where there's, where people are sitting a lot or things like that. Is there any merit to that? Like that there's kind of more one general area where you see patients having wounds typically?
Absolutely. No, great question. And wounds can be anywhere. We do see them everywhere. However, there is a greater chance for diabetic patients to be in the lower extremities or below, usually from ankle or below. And then also, like you said, as with pressure. So if you have a sedentary life or aren't getting a lot of activity, maybe you have that favorite chair that you like to sit in all day long. And if you don't have that sensation or feeling, you may not realize that you need to readjust and move, take some of that pressure off. So because of that, as we're putting pressure on there, we're decreasing that blood flow around that area, and eventually a wound will come from that spot.
Thank you. I think I have just one final question, and then if there's anything else too, I want the crowd out there to chime in as well. Tell me a little bit about, or tell us a little bit about how the hyperbaric chamber has changed wound care over, I mean, I know that they've been around a lot longer than what we've had it here at Boone County Hospital, but could you speak just a little bit more to that?
Oh, yeah, absolutely. And thank you for asking. So, like you said, Sarah, is we do have hyperbaric chambers available, and which is basically what that is it has taken wound care just to a new level and helped to heal wounds that otherwise have been difficult to heal. So what those are chambers that persons can go into. It's usually a daily treatment, 5 days a week, somewhere between 2.5 hours a day for certain persons that are having that extra difficulty in healing wounds. We'll see a lot of diabetics, persons with bone infections, crush injuries. There's several different factors or different conditions that qualify for those chambers if you're not healing. And what that has really done is it's doing, it's pressurizing at 100% oxygen. So it's increasing that dissolved oxygen that's in your blood, which also helps in the formation of new blood vessels to bring blood to tissues. It helps deliver medications to areas that otherwise are not getting the medications delivered to them. For instance, if you have bone infection with very low blood flow, it helps bring that blood into that area and make sure it's an oxygen rich blood. So that has really enhanced the ability to heal wounds. It's also helped with preventing amputations on some persons, or in limiting how much has to be taken off. If perhaps you have a infection that you've had for a long time, a bone infection in your foot, maybe the podiatrist does not have to cut as high as they would have for that amputation had you not done that hyperbaric treatment. So a variety of different conditions that can be treated with that. And we've had some extremely good success with some really good stories on saving limbs and healing wounds from these chambers.
Fantastic. Well, thank you so much. This has been super informational for me. Was there anybody else, and for all of us, was there anybody else that has any questions that might be helpful? You can throw them in the chat or feel free to unmute if you'd like. Or raise your hand. Well, I'm not seeing anybody chiming in, so we must have just covered absolutely everything. You did a fantastic job. I appreciate you taking the time to be here to educate us about the wound clinic and especially around nutrition. I honestly would have not made that connection, but it really makes a lot of sense. I mean, nutrition is important in all facets of our life, but especially in healing. So thank you so much, Will, for being here today, and we'll hopefully have you back again sometime soon to give us more great information.
I appreciate the invite for this.
Thank you so much. Take care.